Hello, I'm Dr. Ryan Kaufman. I'm glad that you've taken a few minutes to learn how you can use what you're currently doing in practice to fulfill your American Board of Family Medicine Performance Improvement requirement. When you successfully complete the self-directed clinical activity, you'll earn 20 activity points towards your overall 50-point ABFM activity requirement while meeting your PI requirement. Not all PI activities give you CME credit. However, the ABFM self-directed clinical pathway also provides 20 American Academy of Family Physicians prescribed credits. I want to show you in how as little as 1 hour you can use the self-directed pathway to get maintenance of certification credit and CME for the work you do on breast and cervical cancer screening. You cannot submit a project until you are finished with it, but you can start it at any point. Your project does not need to be anything complicated. It can be as simple as searching your EHR and finding which patients are due for a mammogram or PAP, and then having staff call these patients, or having nurses give patient education information and starting the conversation about vaccination for patients who are due for HPV vaccine, or making a deliberate effort to link HPV vaccination to the required 7th grade vaccinations. To start, go to the ABFM website at www.theabfm.org. Click on the Physician Login in the right upper corner. Log in using your ABFM number and password. This will bring you to your physician portfolio. In the My Requirements area, click on Certification Activities, then click on Performance Improvement. As you can see, my portfolio recommends performance improvement projects based on the information I previously entered about my interests and my practice. Click on the Show Filters button. In the Filter by Keyword field, type Self, and then click Apply Filter. Now you will see the self-directed clinical project. Click on the View Activity button to see the details, then click on the Start button, and that will take you to the form that allows you to submit your project online. As you see, there's a progress bar at the top so you can see how you are doing. Enter a project name. It is fine to use a name such as Cervical Cancer QI Project, but you may use any name you like. Enter your practice name. Click on the area, then click on Find an Organization. Start typing the name of your organization, then select it from the list, or click on the Create an Organization button at the bottom. Your name, email address, and ABFM number have already been entered. If you are doing this project, then you should select Yes for the question, do you have a direct continuing care responsibilities for family medicine patients? In this case, you are doing this project on your own with your own data, so select No for boxes 1 and 2. Next, you select the beginning date for the project and the completion date for the project. As you have not yet completed your project, you will enter your information and then save it and submit it at a later date once your data has been collected. In box 5, select how your project was funded. Select internally if you did not get any funding for this project. Next, you will need to select a topic area for your project. In box 6, select the relevant topics for this project. In this example, I would use child and adolescent health, cancer, immunizations, vaccines, preventative care, and teamwork. In box 7, you need to type your description of the problem that you are trying to solve. 1 or 2 sentences is fine. For this example project, I will use too many young women are not getting their HPV vaccination and are at increased risk for cervical dysplasia and cancer. In box 8, enter your aim for this project. Make sure there's a clear goal, generally including numbers and a specific time frame. In box 9, you'll be entering the details for your measure. This should come from your goal. You need to enter the name of the measure that you're working to improve, the goal, the number of records, then your baseline, and follow-up data. For the number of charts, generally you want to include at least 10 charts if you're doing chart review to obtain data. However, if you're able to pull the data for your entire population using the reporting function or EHR, you will have data that gives a more complete idea of how you're really doing in your practice. For box 10, you type a couple of sentences describing the intervention you made. For this sample intervention, the description might look something like this. We discussed the importance of HPV vaccination and current vaccination guidelines at a whole office meeting. When a nurse roomed a patient for a teen well visit, they discussed all vaccinations due, including HPV vaccination. We specifically added discussion of HPV vaccination to our well adolescent visit template to make sure that we document vaccine recommendations. The rest of the form is to attest that you were involved in the project. You do not need to be the one doing all aspects of the project in order to receive credit. Next, there is a survey about your experience in doing this PI project. At the bottom of the form, you must attest that all questions and fields have been completed fully and truthfully. Each section of the form saves as you complete it, so if you want to finish it later, you can close it out at any point. When you're finished, click the Submit button. Soon after you submit it, you should receive an email that confirms that you have completed your project. If you have any issues with this process, the ABFM is available to help. There is support on the website, or you can use the live chat function. Again, the website is www.theabfm.org. From 8 a.m. to 9 p.m. Eastern Time during the week, and from 9 a.m. to 5 p.m. on Saturday, the ABFM Support Center can be reached at 1-877-223-7437.